Hi guys, my name's Bon. I'll be teaching a bit about malaria today. In this first video I'll cover the pathophysiology relating to the symptoms, but firstly a bit of background on malaria. It's caused by the parasitic protozoa of the genus Plasmodium, which is transmitted by only the female Anopheles mosquito. Approximately 3.3 billion people live in an area at risk of malaria. This is in 109 different countries or territories. There are 5 Plasmodium species that can cause malaria. You've got your P. falciparum, your P. vivax, your P. ovale, your P. malariae, and your P. knowlesi. Your first two, the P. falciparum and the P. vivax, they are the most common, with the P. falciparum being the most deadly. The P. knowlesi is a zoonosis infection, and it comes from the Southeast Asian monkeys. Main risk factors for malaria are travelling to an endemic country, not using prophylaxis, being a person with low immunity, being elderly, being a pregnant lady, and being a child under the age of 5. I'm now going to explain the pathophysiology of malaria relating to its symptoms. So, in order to first understand the pathophysiology relating to symptoms, we need to understand how the parasite of malaria enters the host and how it works with the host defense systems. So it occurs in 2 different stages. You've got your exo or pre-erythrocytic stage, which is to do with the liver, and your erythrocytic stage, which is to do with your red blood cells. Erythrocyte is red blood cells, so that makes it pretty obvious to know which one is to do with which. So, firstly, in our erythrocytic phase, as you can see in my whiteboard, an infected female Anopheles mosquito will bite its host, so a person. It will then transfer sporozoites from its saliva into the bloodstream of the person. In the bloodstream, the sporozoites will move towards the liver where they infect hepatic cells. When they infect the hepatocyte cells, schizotomy occurs, which is the asexual fission, so that's how it is able to reproduce in the liver. After that occurs, it makes a schizonotes, which contains thousands of merozoites. During all of this is asymptomatic, so this entire phase is asymptomatic, and this can occur for 7 to 30 days before the liver ruptures and all the merozoites are released. However, in P. vivax and P. ovale, they can form what is known as a hypnozoite, which is responsible for a large incubation and responsible for relapses that you may see in patients with malaria. Let's move on to the erythrocytic phase of malaria. This is where all the symptoms happen, and as the malaria attacks red blood cells, it can potentially affect any organ in the body, making it a multi-system disease. Okay, so let's go back to my whiteboard. In the erythrocytic phase, the schizonote in the liver, it ruptures. That produces 10 to maybe 40,000 merozoites. These merozoites attack the red blood cells. When this happens, blood schizotomy occurs, so the asexual fission again to reproduce more. This produces it in its ring form, which leads to the development of the trophozoite, and then finally we get another schizonote. Now we can complete the cycle this way. Some of the schizonotes can differentiate into the male and female form, which if a mosquito then takes that up by taking in some blood, it will reproduce within the mosquito's gut to then make the sporozoites, which then, if they bite a person, will infect that person again. Or we can complete this cycle here by having this schizonote rupturing and then creating the morozoites again, and then that follows that cycle. This cycle occurs for most of the different plasmodiums every 48 hours, and that's how come we can see classical symptoms like the fever occurring every 48 hours, which is a very big sign that a person has a malaria if they're getting symptoms periodically. So, how else do these symptoms occur? If we look at within a red blood cell when it's been infected, the parasite will get energy through anaerobic glycolysis if we follow this pathway. So that's converting glucose to lactic acid. This will result in symptoms such as hypoglycemia and maybe lactic acidosis. So within the red blood cell, the parasite feeds on the hemoglobin. This can produce a toxic product which is toxic to the actual parasite. So in order for the parasite, so the Plasmodium, to combat this, it creates something which is non-toxic to itself, which is hemozoin. So the hemozoin, it exposes the host to Plasmodium DNA. This is pro-inflammatory and creates the release of cytokines. These release of cytokines upregulate COX-2 and prostaglandins, which can result in its fever. Hemozoin has also been linked to the apoptosis of erythrocyte cells in bone marrow, which leads to anemia. Also, if we go back to my whiteboard, when the red blood cell finally ruptures, so the rupture of the red blood cells, toxins, waste, the hemozoin pigment, and a GPI is also released, as well as a number of other unknown things. This produces macrophages to be stimulated, which makes the release of cytokines, TNF, superoxide, nitric oxide, and different interleukins. This produces the many different the many different symptoms of malaria, such as headaches, fever, rigors, nausea, vomiting, diarrhea, and joint and muscle pain. So throughout all this, you might be asking, what is my immune system doing to help fight off a malaria infection that I might have? So I will attempt to explain this in my old trusty whiteboard again. So right here, the immune system and complications that can arise from it when it's not actively fighting malaria. So these complications typically are more seen in the P. falciparum species of the Plasmodium, and that's why it's a more deadlier version of the different Plasmodiums. So within the liver, the Plasmodium is hidden, so it goes, you can't see me, to the immune system. But once it enters the bloodstream, in the red blood cells, when it eventually travels and meets the spleen via just normal blood circulation, it becomes destroyed there. So the Plasmodium, it doesn't want that. It's an adaptive species, so it creates adhesive proteins on the surface of the red blood cells that it's infected. So this allows it to stick to the blood vessel walls, causing a sequestration. Now this sequestration, this essentially is causing a clot in the blood, and this can occur in just about any organ of the body. So it can occur in the heart and the brain, and if it occurs in the brain, it can lead to a coma. It can occur in pregnancy. It can cross the placenta, and that can lead to stillbirths. It can enter the kidneys, leading to renal failure. So once again, this can happen in just about any organ of the body, making it a very dangerous complication of malaria, and it's part of the reason why it is so incredibly fatal if it's not treated. So that brings me to the end of my pathophysiology of malaria relating to its symptoms. My next video should show the diagnostic, treatments, and preventions you can do, including prophylaxis. Thanks for watching. If you have any questions, just leave them in the comments below. Thank you.